mama wanna move. Stop it, boy. In papa wanna move. Stop it, boy. I'm waiting to worry you. You don't marry before today. I already bought my suit. The honeymoon for before Takwa, baby. But you know, yeah. In mama wanna move. Like a custard. If I'm happy, you want mad. Oh, stop banana before you feel me so sad. Oh. When it starts, he go do you like a crocodile. And you go say, I am feeling like to run. And when you run, that's when them go they talk. And when it's shell, I bet let go say, in my mama wanna move. Stop it, boy. In papa wanna move. Today. I already bought my suit. The honeymoon for before Takwa, but you know, yeah. Hey, mama wanna move. Stop it, boy. You know, yeah. Now we did. Never left. Stop it, boy. You know, yeah. Now we did. Hey, mama. Respect, Felix King. Answer, answer. It be you way say you want mamba. No. Scoosh. No. Good. No. It be you way say you want drama. No. Answer, answer. It be you way say you want loud. No. Before, science student had nothing on me. Nothing on me. I used to take codeine. Mix it with a lot of other things. A lot of other very risky things. Over time, the thing go. Skibbity papa, skibbity hey. The thing go. Skibbity papa, skibbity pa. I nearly die overdose. Trauma nearly by me very close. Them say Colorado make a king go gaga. Still take the black mamba. Them hell I'm say you are mixing like a DJ. DJ Akin will get something to say. When them ask him, he said the thing they make me higher. He they make me know they tire. I'm always burning like a fire. Now the thing when I desire. Answer. It be you way say you want mamba. No. Scoosh. No. Good. No. It be you way say. It be you way say you want loud. No. Scoosh. No. Good. Science student will tell you say oh loud oh when it is in the body. When it is in the body. Scooshy oh scooshy. Now him la bagi bo pucci oh. Over time the thing go. Skibbity papa, skibbity hey. The thing go. Skibbity papa, skibbity pa. I nearly die overdose. Trauma nearly by me very close. Them say Colorado make a king go gaga. People wanna me still take the black mamba. Them hell I'm say you are mixing like a DJ. DJ Akin will get some. always burning like a fire. Now the thing when I desire. Oh, you help me sing them like a fire. Now be what till you require. What till you go do not to retire. Before your body go expire.
Of SaaS data and
recovers 1.42 billion naira illicit drug consignment. Intercept over 2 million pills of tramadol in Kano, Jigawa, another Saudi-bound cocaine in body cream. Arrest 3 Ghanaian ladies for cross-border trafficking. An 80-room new hotel in Victoria Island, Lagos, used as cover for distributing illicit substances, has been raided by operatives of the National Drug Law Enforcement Agency, NDLEA, who, after Eze Ayitu, Ofoku Samuel, and Emmanuel Ame were arrested in the course of the operation at the 5-story hotel building between Friday 25th and Saturday 26 April 2025, while 2 other suspects Lagos AKD 472OZ, Toyota Sienna Vehicle marked Lagos,
Ikorodu, His Royal Majesty Oba Kabir Adewale Shotobi. The visit sought to seek royal support and strengthen collaboration in promoting a drug-free society. On the same day, the Sokoto State Command delivered to students and staff of Federal Government Girls College, Tambuwal, emphasizing the health risks and societal implications of drug abuse. Currently, the Kirby lecturer for students and staff of St. James Anglican School, Badaria, reinforcing the significance of early preventive education. On Thursday, 24th April, the Abia State Command took its wider enlightenment efforts to residents of Umogele, Intiga, Insiala, Ungwa North. Participants were sensitized on the threat posed by illicit drug consumption and the critical role of community vigilance. Similarly, the Katsina State Command delivered a wider sensitization lecture to students and staff of Dandoro Community Arabic Secondary School, Doro, highlighting the importance of education, faith, and personal responsibility in resisting drug abuse. Concluding the week's activities on Friday, 25th April, the Niger State Command conducted a wider advocacy lecture for Muslim faithful at Nuruddin Central Mosque, Bida. The lecture emphasized the integration of anti-drug messaging into religious teachings and urged the congregation to play a proactive role in promoting a culture of discipline, integrity, peace, and I hand you over to our host, Mr. Femi Babafemi.
About some of our rules of engagement on this conversation, this program this afternoon. Note, when we approve you to be on the speaker's corner, you are expected to remain muted until the presentation by our guest speaker, who is appreciate your usual Decton, I would like to remind us about the NDLA's call center, where we have a wide range of psychosocial support services for those who might be their family members and their friends. Now, all you need to do to access these services is to call our toll-free helpline 2040 800 provides support to analysis are language friendly, language sensitive, meaning that if perhaps you cannot speak English or Pidgin, you have experts who will be able to communicate with you in any of the three major Nigerian languages of Hausa, Yoruba, Igbo. So this is sure that this service look or seek help when indeed there is need for these services. That much we can take on that. Let's get to introduce formally now our guest speaker today. Indeed, he is Dr. Oloya, is a family physician. Indeed, Dr. Oloya is a distinguished family physician and reproductive health expert with over comprehensive primary care to patient Shagamu, that's in Ogun State. He is a fellow of the Royal Anthropological Institute of Great Britain and Ireland, a council member of the Society for Reproduction and Fertility, and an active member of both the Nigerian Medical Association and the Gambia Medical Association. Presently, Dr. Ewe in welcoming Dr. Olubenga Ewe. I invite him to unmute himself now while we listen to him. Yeah, you are muted, Dr. Ogbenga. Please unmute yourself and then go ahead. I'm muted now. Let's hear from you.
Of National Drug Law Enforcement Agency in person of Brigadier General Buba Marwa, retired. Director, Media and Advocacy, Mr. Baba. there's one parent that lives within that neighborhood. In the morning, the father and the mother, they go out. They leave the children alone. So one child, 6-year-old boy, will go play around and these people. One day, we just found this boy smoking Indian hemp. It took the intervention of a neighbor, a Nigerian woman, who now told the child, school uniform for the child, register the child in school. If not for the intervention of that woman, who knows what that child would have grown to become. That is the importance of environment. Your environment can influence you either for good or for bad. Economic stability. Income level influence access to healthcare, nutrition, and housing stability. The level of income determines, oftentimes affects what you eat. A lot of time, if you're a low income earner, but the
I was the head boy in my primary school, senior prefect and best graduating student in my secondary school, but drug abuse almost ruined my life.
I was on an average of 2 grams of cocaine per day.
I was taking 8 ampoules of pentazosine daily.
European
User, a dealer, and a gangster. I saw other users drowning. I knew I didn't want to be like them, but I was already trapped. My family disowned me.
My employment was terminated.
I'll go out well-dressed and return shoeless, shirtless in exchange for drugs.
I was saying things that were not real, and I once stabbed myself because I felt something crawling under my skin.
I contacted NDLEA and started therapy.
I spent 3 months in therapy.
I spent 8 months.
It's easy to relapse, but your mind has to be stronger than
that. Does not love you. You are not the one using drugs. Drugs are the one using you. Say no to drug abuse. Hello, dog.
I was the head boy in my
I was on an average of 2 grams of cocaine per day.
I was taking 8 ampoules of pentazosine daily.
European shisha, cocaine.
I sold my car, sold my house. I'll go out well-dressed and return shirtless in exchange for drugs.
I was saying things that were not real, and I once stabbed myself because I felt something crawling under my skin.
I contacted NDLEA and started therapy.
I spent 3 months in therapy.
I spent 8 months.
It's easy to relapse, but your mind has to be stronger than the crazy. cravings.
Drugs does not love you. You are not the one.
You go just die true. Drama handle you go just die If anybody give you banana, sky, daddy give you cocaine, what you could Simba, give you skunk, give you loud, tell you send I want that. Child, that's how you take start. What's in my eyes and Simba, what you could Simba. No be say, I know they hear when they say make I stop. Make I leave you before you kill me. Another one star, make I leave you before you kill me. Them say cocaine London be lala. On the streets of Lagos, they say cocaine don't become the lala. Every day men's the west, taking the lala.
That's what we get from some of the service providers. We have to be switching from one network to the other, but we're glad we are back quickly. That just invite Dr. Jimmy in our
social ties. That is by promoting community engagement and support groups to provide individuals with emotional backup. And I gave an instance of like people that have depression, maybe in the same locality, they can have a recreational center where they sit together. They can equally have a platform, chat each other, they discuss, greet one another. If one is having a particular problem, can put it on the platform. If there is no improvement, there is access to resources.
Dr. Abdullah for always being present. We also see Jefta Roberts. Thank you, Jefta Roberts, for your time on this platform. We've also seen John Ogunjimi. Thank you, John Ogunjimi. Equally, we'd like to acknowledge Funsho Jimo. Funsho Jimo is our conversation today. We may have to do a direct call with. We may have to do a direct call with Dr. Ewe Oyana, if Ewe Oyana, if
say that I said that if there are people that have depression in a particular environment, they can have a recreation center where all of them can sit down. They can have a recreation center where all of them can sit down together, discuss their problem, thus assisting one another. Another way is if there is a platform, a WhatsApp platform, whereby they can discuss, okay, I have this problem. Another person at the other end will say, okay, I have this problem. Another person at the other end will say, okay, when I have this problem, this is what the doctor did for me. When I did it, I got relieved. So then, the second point is access to resources. I said, making individuals have access to services so that such healthcare services is within the neighborhood. It's not far because money can be a challenge. I said that the patient too have a right to know. Patient too have a right to know about their condition. When a patient have an understanding of what is wrong with him or her, because the healthcare provider will not follow the patient to his or her abode, improving these challenges. Community programs that promote healthy living, coping strategies, and provide support for those affected by substance abuse. Because emotional support goes a long way in providing healing for an ailing person. It's on that note that I said that it would be appreciated if the organizers of this program can go a step further by arranging a stage play in 3 common languages of the country. That is not everybody that may be opportune to listen to presentations, but when they listen to the play in their own language, and the play should be constructed in such a way to convey the desired message to the individual listening to such plays, it will go a long way. Then I said in conclusion, addressing social determinants of mental health, drug abuse, and coping with chronic condition requires a multifaceted approach which emphasizes on education, prevention, and access to care. So it's on this note that I want to thank you for your attention, and I look forward to your questions and suggestions. Thank you very much.
All right, thank you very much there, Dr. Benga Eweria, for that excellent presentation. We did understand, some of the tricks the networks try to play on us, but then we will try to advance the conversation as fast as we can within the next hour so that we can cover quite a lot of lost grants. Once again, we'd like to appreciate Dr. Benga Eweria, a family physician who has indeed giving us insights into our topic for today, that is addressing social determinants of mental health, drug abuse, and coping with chronic conditions. And he has tried as much as possible within a space of 30 minutes to package all of this together succinctly, and then we'll start reading to him some of the questions we're having at the moment. For those that may want to intervene, contribute, or ask Dr. Eweria some questions, it's time for you to request for the mic, and when we approve you, please remain muted until we come back to you to invite you to ask your questions, make your contribution, or interrogate the presentation by Dr. Benga. But first, let's hit our DM to get to read 1 or 2 questions, and then we come back to the platform. If anyone is ready, here would get definitely for those on Facebook and on YouTube for his presentation, despite the challenges of network from both sides, but then we try to grab some basic facts from what he's saying. But my question is, despite all of this awareness and sensitization by the NDLA and other non-governmental organizations, why is talking about mental health still like a taboo in many families and communities, especially in Africa and in our country, Nigeria? I would love to get Dr. Benga's take on this. All right, thank you very much, Adediba. Let's have Dr. Benga now. Please go ahead, Dr. Benga.
Well, thank you, Mr. Adediba, for the question. The religious book did say that my people are perishing because of lack of knowledge. And at the beginning of my presentation, I said knowledge is power. The way and manner information is presented to matters. I want to believe that the awareness about mental health has not reached those people, or maybe the way it is presented to them, they did not assimilate it, or they did not understand it. Take for instance, there was an instance of a woman who had a breast cancer. He met a doctor. The doctor told her that he's going to cut the breast. The woman said, "Why will you cut my breast?" Then when the thing became advanced, he met another doctor. That other doctor explained to her why they have to cut the breast and what she will do to cope with it. He said, "I didn't know. If they had told me, probably my condition wouldn't have degenerated to this extent." So I want to tell you that the way and manner this mental health awareness is presented to them matters. And even their children, if they are well, the awareness is presented to their children in school or in mosque or religious houses, and they take it to them, they are likely to take it more. Maybe if the awareness is taken to the religious houses and schools, their children will tell them at home, their pastor or imam will tell them at when they go for religious activities. And by the time they keep hammering it, most likely they will cope, they will understand, and anything that is not clear to them, they ask them question. And after that question, they get to understand and they change their ways. I hope I've answered your question.
I do hope so too. Thank you very much, Dr. Benga. Let's get to the next question. Okay, let me give John. John, you are on the speaker's table. Is it a question or a contribution? John, please go ahead.
My question has been answered. Dr. Benga has spoken well. We have answered some of the questions I have in mind.
All right, thank you. Thank you very much there, John. Okay, sorry, I thought I was muted there. Sorry, apologies for that. I was actually reading, skipping some questions and then reading. I have this one from Janet. Janet is asking, how does access to education influence the mental well-being of children and adolescents? And then the second part of our question, how do systemic barriers to healthcare contribute to addiction relapse? Thank you. I would love to get answers to this. All right. Thank you to Janet. Let's have Dr. Benga.
Thank you, Mrs. Janet. Access to education goes a long way. I did say in my presentation that a patient has a right to know what exactly is wrong with him or her. And in communicating such message, certain level of education is expected for the patient to flow at the same frequency or at the same pace with you. Some people are doing some things because of their level of education. They don't know what they are doing is wrong. Like, as we speak, there are certain parts of Nigeria that they don't wear clothes. They are naked. And when you wear clothes, you get to such community, you are seen as a strange person. That is because of the level of their exposure or education. So, access to education, if there's a particular mental challenge, and you are asked to take the medication maybe once or twice in a day, you can take once, or maybe you can take for one day and leave the drug because you don't have an understanding of why you should take those drugs. And certain levels, some diseases are common within the less educated and not common within the educated one. Reason being that they know, the educated ones knows what to do to prevent such things. You may see somebody that will take alcohol, paraga, in the bottle pack, in the morning, in the afternoon, in the night, and he doesn't see anything that is wrong in that. Somebody that is educated will not see reason why he has to take alcohol in the morning, in the afternoon, and at night. So that is why access to education plays a role. And education too makes it easy. When somebody has a challenge, you can counsel the person, go to a health center or go to hospital. It makes it easy for the person to understand what you are saying. But education is key. If you have seen artisans that are educated, and the one that is not educated, if they handle the same job for you, you will see the difference between the two.
So thank you, Dr. Benga, for your presentation. I'd like to refer to the earlier part of your presentation on social determinants of mental health. You indeed mentioned poverty, which encourages people to eat all manner of junks, and then that affecting their health. You saying that even the rich are not exposed to junks or don't take to junks. I'd like to seek clarification on this part of Dr. Benga's presentation. I would also like to, if he can, because he's part of presentation on social determinants of mental health were not clear all through, so if he can also brush or summarize that for us so that we can have some takeaway from there. Thank you. All right, thank you very much for joining there. Okay, Dr. Benga, there you have it.
Thank you very much, Mr. Johnny. What I was saying initially when I started the presentation, I said that age, gender, and lifestyle are said to be the common causative factors of diseases. Age in the sense that when a woman is old, she's disposed to osteoporosis, as in their bones break very easily. Gender, male are more predisposed to schizophrenia, and women are more predisposed to depression. Lifestyle, when somebody takes alcohol too much, it affects him or her. I now said that these three things contribute to a fraction of what affects our health. And I said, I will let you to know how your house, your income, and your education contributes or affects your health. These non-medical factors, like the house, income, and education, are called the social determinants. I give example that if somebody is not unemployed, his level of income is low. By virtue of the fact that he doesn't have plenty money, it determines the kind of accommodation or the environment where he will rent his apartment. So I've related those three factors to one another. Then I said that relating mental health to social determinants, that relationship is profound. Access to care is one of the factors in relating them. Disparity in healthcare often leads the vulnerable population without adequate mental health services. So the vulnerable people or somebody that has depression that doesn't have access to healthcare, the condition will get worse. Because there's a problem affecting the brain and there's a drug to reverse that condition. If such individual does not get that drug, there's no how that problem can be solved. Oftentimes people go to spiritual houses, but I need to let you know, spiritual problems are solved with spiritual solution. Medical problems are solved with medical problems. When I went further to tell you about isolation, I said lack of social connection can worsen the feeling of loneliness. Loneliness on its own is killing because you begin to think about things that are relevant and they are not, and things
when Dr. Benga spoke about this, on this platform, when you are looking at mental health problems, you look at it in three dimensions: the biological, psychological, and social. All these three factors interact, to determine the outcome. So you may not have the social problems as he listed, but the person might have biological risk factors. Maybe has family history of this depression. Somebody the person to have only. That has nothing to do with your social status. Alright? And so many other things like that. So I don't know, maybe this explanation will have added some clarity to the question. Thank you very much.
Hold on there, Dr. Abdullah. Thank you. Kenneth is asking a follow-up question. Thank you for the intervention. School and even back home for treatment, who should attend to a case of depression? Person, that's the same Kenneth, is a follow-up question to his question earlier answered by Dr. Benga with interventions from Dr. Abdullah. He's saying there was a dispute as to who should
present, but definitely she was within that
psychiatrist. More hands on the psychiatrist table. So mild to moderate, more often than not, we do not need medication. Psychotherapy, what we call talk therapy, might be enough to do that. And
say people with chronic conditions in challenging social environments like we have in our clan. Yeah.
I didn't get the question, sir. I didn't get that question. There was break off.
Dr. Abdullah. Dr. Benga, please go ahead. He's asking Collins.
I didn't get.
Okay, Collins is asking what strategies would Dr. Benga and Dr. Abdullah suggest will help people cope with chronic conditions in challenging socio-economic environments. Do you get that?
Well, I want to tell the person asking question that there's nobody on this planet Earth that doesn't have a problem. The way and manner we cope with our problem distinguish one person from the other. You may think your problem is the worst problem ever in the world. But when another person that you are talking to tell you it's your own problem, you know that your own problem is smaller. So, and to every problem, there is a solution. And this person should know that whatever thing that is beyond what he can control, he should leave it to God. Because there are instances now, maybe his economic capacity is at a level. He has to work more to increase it or become more ingenious. So that way, I think he can cope with the challenge that is facing each and every one of us presently. Because whatever thing is happening now is affecting everybody in the land. So the way and manner we respond to the situation distinguish distinguish one person from the other. So I think that's my Dr. Abdullah, if you have anything.
Okay, like I was saying, people in such a condition, they often face additional barriers. Conditions they have additional barriers such as poverty, low health literacy, limited access to health care, and social stigma. So these factors can actually worsen disease outcomes and lower quality of life. You know, so a comprehensive mechanisms like social support groups, you know, when communities come together, when people of similar problems come together, you know, people of similar problems come together, you know, and form social network, they can actually be of help for each other. That can also help. And like somebody asked about spiritual medicine. Actually, sometimes spirituality is actually a very good thing for us. factors when it comes to mental health, and studies have shown that people who are highly spiritual tend to have, some level of reprieve when it comes to issues like this. So spiritual and religious practice can be a very good thing. It gives people hope. Hope is, it's a whole thing on its own. Let me not digress to that. It's a whole thing on its own. Let me not digress to that. But hope is part of the healing process, and that then adaptive psychological strategies like acceptance, positive reframing, all these things can help with people, with chronic medical condition. Then we look at the health system and community response. The community can actually come together and even show economic interventions, either from government, from NGOs, or from people that are well off. They can actually intervene and provide some support in terms of economic. But if the person just comes to you, you measure the BP and say, look, okay, your blood pressure is high. I need to give you medication. You give the person medication. You know, one, most of the chronic medical conditions, they don't have signs at the early onset. People may not notice the destruction going on. You know, they may not be paying. Hypertension, and he's not. Having any physical signs. Or doctor or something like that. So it is important you do that. And then some other you know, in breaking people, you know, affordability, for example. All right. Also accessibility.